We moved in November. At first, we didn't really notice anything. It was kind of like Milo's just getting colds, we got colds, and then it got really bad, like she started getting pneumonia and she was sick all the time. I went to my family doctor and asked him if the reason Milo was having so much trouble breathing and with colds and pneumonia was because of the fact that we were in a smoking building, and he said that it could be the reason for sure.
Secondhand smoke is the smoke from a burning end of the cigarette, as well as the smoke that's exhaled by the person who is smoking. And we know that tobacco smoke contains around 4,000 chemicals, hundreds are toxic, and almost 70 actually cause cancer in humans. And this is a real public health concern for us because we have a lot of people who live in multi-unit housing.
There is no risk-free level of exposure to secondhand smoke. Secondhand smoke is a Class A carcinogen. We know that people that are exposed to secondhand smoke have significant health consequences, ranging from acute exposure, things like asthma, to long-term health consequences like death. Health Canada estimates that 800 Canadians die each year from exposure to secondhand smoke, and those deaths are completely preventable.
Just like with direct use of tobacco products, everybody's at some level of risk if they're exposed to secondhand smoke. Young children, infants, carry unique risks. Increased risks of asthma, upper respiratory tract infections, but most serious and concerning is that young children exposed to secondhand smoke have a significantly increased risk of sudden infant death syndrome, and that's especially important in a multi-unit dwelling where people can't necessarily control that exposure.
We had a baby in an apartment that had secondhand smoke. Neither of us smoked, so we didn't think that it would affect us in the apartment at all, but it did, and very much so.
We know it comes in through simple things like under the door, from decks and patios, from gaps around plumbing and electrical outlets, and also from bathroom fans and kitchen fans. This is why we want to increase access to smoke-free multi-unit housing.
A survey done in the last few years by Smoke-Free Nova Scotia of tenants, about a third of people were indicating that they were regularly exposed to secondhand smoke, and the vast majority of them were not happy with that. And when asked, over 60% said they would be supportive of smoke-free dwellings.
Smoke-free housing is not discriminatory. There's no legal right to smoke in Canada, so having a smoke-free housing policy in a multi-unit condominium or apartment, what that really means is people would agree not to smoke in their unit or in common areas, and ideally on decks and patios. We already know that many people who smoke already choose to smoke outside, so for them this is not a big change. And we've seen by putting these policies in place elsewhere in Canada, there's been great success.
We moved from the building into my boyfriend's parents' home. Within 3 weeks, we noticed her getting better. She hasn't had to use her puffer since we moved. There's definitely a big change. She's even started gaining weight.
The need is there from a public health perspective. The demand is there from tenants, and we need to move forward.
We're looking for a new place, and a smoke-free building is definitely a priority for us.